So 2 years have passed since COVID-19 shook the world. And with all the attention in the novel coronavirus, other existing pandemics were left behind, particularly affecting the most vulnerable communities. Today joining us, we have Françoise Vanni. She is the Director of External Relations and Communication in the Global Fund. And she's here to elaborate more on this topic. So, Françoise, can we talk a little bit about the importance of doubling down our efforts to combat diseases such as malaria, tuberculosis, and HIV to achieve the SDGs in 2030?
Thank you. Yes, indeed, COVID-19 has impacted very strongly the fight against existing pandemics such as HIV, TB, and malaria. It has created a massive disruption, and for the first time in 20 years of the fight against HIV, TB, and malaria, for the first time ever, we've gone backwards in terms of the results achieved. So we do have to indeed double down. We do have to accelerate and intensify our efforts if we are to recover the lost ground as a result of the COVID-19 pandemic and to get back on track to achieve the SDG target by 2030. We have only 8 years left.
Now, Françoise, can you walk us through the role of the Global Fund in the COVID-19 crisis in developing countries? I know that the Global Fund is known for acting very fast and deploying these resources, these funds. So can we mention a little bit the process when we were in the crisis?
Absolutely. So the Global Fund was created to fight pandemics, the deadliest pandemics by then, 20 years ago, HIV, TB, and malaria. So obviously when COVID-19 started, we were very fast in deploying and adapting our own resources and efforts in order to allow low and middle income countries to also respond to COVID-19. And we did that in multiple ways. We deployed additional resources, more than $4 billion additional to what we normally deploy in those countries. We've adapted our programs with all of our partners on the ground to make sure that we were fit for a COVID-19 context. And we've also, as we always do, partner with others, and we've been part of creating the ACT Accelerator coalition globally to really allow all the forces to be joined up to support countries in an equitable and efficient manner. And as we speak today, the Global Fund is the largest, the first provider of everything that except vaccine for low and middle income countries. So that is treatment, diagnostics, personal protective equipment, oxygen, and other essential and vital tools to fight COVID-19.
All right. And the Global Fund is known to act, as I mentioned, fast and very effectively when this crisis occurs. And you deploy all necessary resources for diagnosis and for treatment continuity. So this is in part because you've developed local partnerships, right? So can we elaborate more on the importance of increasing those partnerships globally?
Absolutely. So the fact that we were very fast at deploying resources and supporting countries in their response to COVID is thanks to being a partnership. And in that sense, the Global Fund is rather unique because as part of our governance, we have donor countries, implementing countries, the private sector, civil society, and communities around the same table deciding what to do and how to do it. And that same partnership model is replicated at country level, where all the partners involved in the fight against HIV and malaria, but also in health system strengthening, are together and discussing how to best respond. So we've leveraged that very same partnership model, those very same infrastructure that have been put in place over the past 20 years to support the response to COVID. And this is thanks to this partnership that we've been able to be fast. And I think the Global Fund has been one of the fastest in terms of deploying additional resources for low and middle income countries to respond to COVID. And also that partnership model has allowed us to be very inclusive and very equitable in the way we have deployed resources. And those have helped both respond to COVID directly, but also they have helped mitigate the impact of COVID-19 on the fight against HIV, TB, and malaria. If it hadn't been for the fast response of the Global Fund, probably the impact would have been much worse. You may remember at the very beginning of the COVID-19 pandemic, WHO forecasted very dramatic impact on HIV, TB, and malaria. And indeed, we did get a strong impact, very negative one, but not as bad as we would have had if we hadn't been able to respond at the scale I indicated, with more than $4 billion additionally deployed to our partner countries.
Exactly, yes. Let's remember that during COVID, doors were closed for many people who were having or needed these treatments for these other pandemics, and they were closed to avoid the further spread of COVID-19. And you did act very fast in order to deploy the resources necessary to mitigate that that crisis in that way, and to prevent it from keeping it growing. Can we mention then some examples of how you acted fast enough during COVID-19, but to help specifically those communities already battling with malaria, HIV, and tuberculosis?
Absolutely. So it's about resources, it's about partnership, but it's also about really communities on the ground, how they, and community health workers, really the frontline people who have been adapting and responding to COVID. So it's all down to them. And the way programs were adapted to mitigate the impact of COVID-19 was, for example, one of the key things the Global Fund supports is bed net distribution to fight, obviously to prevent malaria. And as you know, malaria kills a child every minute, so it's not an old pandemic. It kills today a lot of children and people, particularly in Africa. So we adapted the way we distributed such bed nets, because, for example, before it was a collective distribution, and obviously at the time of COVID, you cannot have everybody in the same place because of COVID. So we had to adapt and distribute door to door. So community health workers did adapt and distributed bed nets to families door to door. That's one of the examples. Another example would be on HIV prevention, which is obviously really, really key to not stop, because otherwise you find increased incidence rates down the line. We've been using digital technologies very much. So communities and civil society organizations working in HIV prevention have been using all sorts of technologies, as we do, those Zooms, etc., to make sure that they could continue their prevention programs. And they've also provided different prevention tools by mail, for example. So all sorts of adaptations have taken place, led by communities on the ground.
And not only did we have COVID-19 as a disruption, but we also had the war in Ukraine. Not many people know this, but Ukraine does have a huge population affected by HIV and malaria. So can we talk about your speedy response during the war, during that crisis, to deploy the resources necessary to ensure the treatment continuity?
Absolutely. So Ukraine is indeed one of the high-burden countries when it comes to HIV, but also tuberculosis. And we have programs there. We support partners on the ground. And as soon as the war started, we've been immediately considering how to deploy additional resources, because in those contexts, you need to adapt, but you also inevitably need more resources because things become more complicated and more expensive. And so we've deployed 15 million additionally through our civil society partners there and other partners. And the main objective of such support is continuity of programs. Really, that's the main objective, because as soon as you get disruption of treatments, you can imagine the consequences for people who need those treatments on a daily basis to continue their fights against HIV or tuberculosis. And we are also investing in continuity of prevention programs, but it is obviously much more complicated in such a context, as you can imagine. So the thing perhaps to emphasize here is that not only are we adapting and responding in the case of Ukraine, but we do that in many conflict-affected contexts or challenging operating environments more broadly, where we invest approximately 30% of our resources supporting populations that are also not only fighting high burden for HIV, TB, and malaria, but also challenging, fragile or conflict-affected contexts.
And with all the bad that COVID-19 has brought, there also has been a lot of attention in research and in innovation in regards to health. So I imagine that you're using that momentum to get more funds and to act fast, to in what regards to these forgotten diseases, correct?
Yeah. So indeed, I mean, we were a little bit concerned by the fact that the attention, perhaps the global public attention to health might be decreasing. And in fact, obviously, COVID-19 reminded very acutely everyone around the world that we are not safe until we are all safe, right? And that's one thing, that we are all in this together, and the argument for equity is really strong. And the second thing that was really sharply, in the center of the public debate was the fact that if you do not invest in health and in health systems in order to prevent fight current pandemics, but also prevent the future ones, then the economic costs are just overwhelming, just beyond anything that an individual can even think of. So the case for investing in health and the case for equitable investment, because we cannot be safe until and unless everyone is has been made very strongly. That being said, the world is also, the global community is known for jumping from one crisis to another, and I think the important element now is to sustain such momentum and not to fall into the panic and neglect cycle. We panic and then we forget, and we neglect, and then we panic again when the next pandemic hits. So it's the sustained investment in health systems and in health more generally is really important if we are to reach this SDG target by 2030.
Now, what were the lessons learned from COVID-19 that we can apply when future crises occur? And how can we ensure that the major pandemics, HIV, malaria, tuberculosis, are not the losers of another pandemic in the future?
Many lessons, many. But to be brief, perhaps the interdependency that I've mentioned. Perhaps, when people here, let's say in Switzerland, thought about malaria, they didn't think necessarily that they were themselves very vulnerable to it. And COVID-19 has reminded us that, indeed, we are all vulnerable to big pandemics. And in the case of tuberculosis, for example, we face multi-drug resistant tuberculosis, and that's the threat to global health security. Right? It's not something that affects somebody else somewhere else, it's here. So that's a lesson that we've learned, interdependency. Another lesson that we've learned is we need to invest in health systems. We need to invest in health systems. The countries that have been able to respond and to mitigate better the impact of COVID-19 have been the countries that have strong health systems, including, importantly, community health systems. So again, back to communities, frontline community health workers, people who are really on the ground. So the importance of communities, the importance of health systems, and the importance of global coordination and collaboration. I mean, it wouldn't have been possible to mount such a response if we hadn't, joined forces together with all the WHO and many other global health actors to make sure that everybody would bring their own strengths and that we were able to have a coordinated response in support to the low and middle income countries more particularly. So perhaps those four lessons.
Now, the global fund is replenished by governments. The private community cannot or doesn't contribute to this. The governments are the ones who contribute.
No. So in terms of the Global Fund, and I believe many other global health organizations, we replenish every 3 years, indeed, to get the resources we need to be able to support the fight against HIV, TB, and malaria in more than 120 countries. We do that every 3 years. The resources we get are mainly from governments, you're right, but we also get resources from the private sector, and increasingly so. And those resources are also extremely important. They help us catalyze changes on the ground, and they bring both, cash, but also in-kind and expertise in some cases. So we are replenishing the Global Fund this year. So thank you for the question. It's a very important year because the Global Fund is seeking at this point in time, with the support of the host, which is the US government, this year to raise at least $18 billion. And that is in order to regain the lost ground during the COVID-19 pandemic, get back on track to achieve the SDG target by 2030, strengthen health systems. As I said, it's so critical to fight AIDS, TB, malaria, COVID, but also all the pandemics that we know will come. The WHO has been very clear, we know they will come. And in order to also support communities on the ground. So that's what we are seeking this year. And hopefully in the next 3 years, we'll be able to save 20 more million lives thanks to that hopefully successful replenishment.
Indeed, hopefully. Now, any further message that you would like to bring to the community here, anything that we need to do to act now to, again, double down these efforts to tackle and combat these forgotten diseases that, well, yeah, that have been forgotten for the past 2 years?
So I think we've all learned lessons, but we tend to forget those lessons as soon as the next crisis hits. And I think what is really important for all of us who are, committed to global health and is to make sure that we do not only focus on crisis, but really have a sustained investment and a sustained effort to not abandon the SDG targets, right? Because if you deal from, crisis after crisis, you lose track of your long-term objectives, and it's the only way to prevent future pandemics to hit so hard and so badly people and the economy. We really need to sustain the investment in health systems, including community health systems, in the coming years.
Thank you so much. So we do have 5 minutes left, and I want to open the floor to the public in case any of you have any questions. Yes?
Thanks very much for the presentation. Just in all the discussions that are happening now at quite a high level about preparations for future pandemics and the financing for those pandemics, as you've mentioned, it's important for communities and civil society to be involved in those. Can you speak a little bit about what the Global Fund is doing to support and advocate for civil society involvement in those discussions, and also to support civil society and communities' own advocacy to be involved in these financing mechanisms and these financing discussions? Thank you.
Thank you very much for the question indeed. So there are a lot of discussions at the moment in terms of how to best prevent the future pandemics. One of the things we say we advocate for is to make sure that we do not focus on future potential pandemics at the expense of the current ones that are, killing millions of people, and we need to really approach that in a comprehensive manner. The other thing that we do say is that we are not going to achieve anything without civil society and community. So we are very clear on that. And we are trying to leverage our model and our unique experience of having civil society and communities at the table in our governance, both at global and local level. We're trying to push all the other discussions that are taking place as we design the future, pandemic preparedness architecture, that the same sort of model is used. And we always push for civil society voices to be heard, to be included, to be meaningfully engaged. Internally, we have different ways by which we support and engage civil society and community organizations, as I said, both in terms of governance, in terms of the advocacy work that we run and support, but also obviously in terms of the programs themselves, making sure that civil society and communities are at the table at country level in what we call the country coordination mechanism, so that they can advocate, hold accountable, but also implement programs themselves that are better suited for the most vulnerable, the most stigmatized population that we seek to support. So at all levels, both internally in the Global Fund Partnership, but also in the broader discussions that are taking place. Thank you.
Yes?
Let's see, it works. It works. I'm Doreen Mulder, working with PharmAccess, a foundation aimed at improving access to healthcare. My question would be, so now we have had multiple pandemics, and you're talking about we need to strengthen health systems. How would you look at, or how does Global Fund see working more in a horizontal fashion rather than the disease-focused? Because maybe tomorrow we have another disease.
Do have another disease already, right, with COVID-19. So thank you for the question. Really important, dear to my heart, and very much an evolving discussion in the Global Fund, because we are already the largest provider of grants to low and middle income countries when it comes to health system strengthening. So that's, beyond the 3 diseases that we've been created to fight. In the context of COVID-19, we have increased our investment in health systems. And in that context, we have also, and our board and our constituencies have developed a new strategy that we are now preparing for the rollout. And this new strategy is very much putting integrated health system integrated, people-centered health systems at the center of what we seek to achieve. So we have evolved in that sense in terms of the approach and the framing. So obviously, our goal is to end AIDS, TB, and malaria by 2030, as well as strengthening health systems, including community systems. And we will do that in a way that is building on our strengths and what we've been experiencing in countries. So very much focusing on things like supply chains, health information systems and digital health, obviously community health workers and other labs and surveillance systems. So key areas of health systems that we know are needed to fight AIDS, TB, and malaria, to fight COVID, as we've learned, and that will be also helpful to prevent and prepare for future pandemics. Thank you.
Now that's a wrap for this interview. Thank you so much, Françoise, for joining me today and sharing your insights. And I wish you the best organizing your upcoming and very important event in the US in September.
Thank you so much. Thank you.